Good morning, all of you. This is Bhupesh Tiwari from Modern Medi Health Healthcare Media Networks. Today we are one of the industry leader, Mr. Sanjay Rajpal, the general manager of Ypsomed India, for coming here specially for giving us an interview series in the Modern Medi Health Media Networks. Thank you so much, sir, for your time.
Bhupesh, it's my person with commitment like you, with dedication and simplicity. That is why I'm here.
Thank you so much, sir, for your kind words. So I have few questions regarding your leadership insight and Ypsomed India initiatives and diabetes management landscape. So I start with the leadership insights. So my first question is, sir, how do you stay up to date with the latest trends and innovations in diabetes management, and how do you incorporate this knowledge into Ypsomed India strategy?
Latest update, first of all, it is very, very important at whatever position you are. In order to keep yourself abreast what is happening, because where we are today, it is knowledge, only knowledge that makes the difference. So definitely either through online and even through offline, different print or even online reports, what we get either from our global headquarters or even from local connections. Even lot of learnings from Modern Medi Health I get about the latest, about whether it's not only diabetes, drugs or devices, even about the nutrition. I saw your latest issue, latest nutrition as well. So that all helps me, rather than you can say I read a lot, and that is the one of the reason. And how I use this, because their ideas or knowledge can be plenty, but I always believe execution is the key.
True.
If you cannot execute, what is the point of having knowledge?
Right, sir.
And same message I give to my team as well, execution. So that's whatever I feel can be helpful for our organization or for our customers or the people who use our products, whatever can help them, we should implement that.
So my second question is, how is Ypsomed India working to improve access to diabetes care management for patients across India?
Access to healthcare, whether they are sustainable development goals, access to healthcare is very, very key point. And as an organization, we are committed to improve the accessibility. Therefore, Ypsomed as a company, whether it's Yogdhan Foundation, Diabetes Awareness Foundation, Blue Circle Foundation, wherever, either through education or through our products, wherever we can support in whatever way, and our global headquarters support us fully in that, so that we can not only just to sell, even in skill development, education, training, and even providing our products to some people who need, either at the subsidized cost or even sometime free of cost as well.
So as I see on a regular basis, sir, you are doing very philanthropic work as well. You associate with many organizations, those who are, not in, in that particular state where they are expense a lot. But Ypsomed, as a representative of Ypsomed, you are doing a very marvelous job in India. I see you for last, I follow your journey for last 15 odd years, sir. Thank you for this commitment and your time, sir. And my next question is, what are the most significant challenges you face as a leader in the industry, healthcare industry? How do you overcome that?
Challenges are the part of, you must be facing as well, we all face. But how we face in terms of that, I personally feel, in order to make the difference in the life of last person in the queue of diabetes, or at least in not only diabetes, any chronic diseases. It is industry, policy makers, even the media groups, even the healthcare professional, all needs to come together. And sometime I feel that this cooperation more is to be needed, and only then, as a country of 1.4 billion people, we can make the difference.
True.
It is not only one stakeholder who can do alone. Even media houses like yours, industry companies like ours, or even healthcare organization needs to come forward.
True, sir. Sir, about the Ypsomed India initiative, Can you please tell us about Ypsomed India's current initiative and project focus on diabetes management?
Because our projects are consistent. First is that skill and capacity building. Because in really, if we want to make a difference in the life of people, skill enhancement is very important.
True.
Whether these are latest technology innovation,
Indeed.
those needs to be brought, or at least our healthcare professionals should be aware that what is happening in terms of technology, innovations,
Right.
or how digitalization is making the difference. So we are consistently trying that whatever is happening globally to at least showcase here to healthcare authorities, to healthcare professionals. At the patient levels, consistently through our podcast, The Happy Moments, Pal Pal Ki Khushiyan,
Right.
we try to bring the share on this platform, the journey of people with type 1, their families, many healthcare professionals, that how even people who have less resources, still they have fought out. And they have fought successfully. We bring their journeys consistently together as well. And even through many other organizations, we try that these activities are not just waiting for World Diabetes Day. It
Right.
goes on and it continuously goes on. Diet, nutrition, training, skill development, bringing the people together.
Right. Sir, how is Ypsomed India working to improve access to diabetes care management for patients across India?
As I mentioned, not only Ypsomed India, through various organizations whose vision, whose thoughts, whose mindset matches, and we believe that they also want to make the difference. We are trying that not only through our products, even we are partnering with many other organizations, that if we all can share the knowledge or whatever helps the people with diabetes, we continuously do it.
So, diabetes management landscape, what is the most significant trend and developments shaping the diabetes management landscape in India today?
Actually, what are the new changes? Because now if you look at that in terms of medical devices in diabetes, now people, big population for people, even the organizations are shifting from syringes to self-injecting
Self-injecting
pens.
pens.
That is no doubt about it, making lot of ease up usage.
Right.
That is happening. And even people who are from a little bit economically weaker section, even they are getting pens as well. And besides pens, even accessibility in terms of diagnostic, either because of diagnostics, lot of charitable organization, these all things are getting more reachable. And in some of the government schemes like Ayushman Bharat, Jan Aushadhi, even these are trying to help, because people who cannot afford
Right.
are getting, and we are also trying to support these initiatives.
Sir, at the end of this interview, is there any message you would like to convey to our readers more Ypsomed India's commitment to diabetes management and patients care?
Our message to your readers is that read, trust more, and contribute more. Only then any lifestyle diseases, non-communicable diseases, change can happen. It is not only the responsibility of a doctors or the nutritionist. All of us can together bring the difference. And besides medicine, it's self-motivation. It's you can say, even if you can help somebody, do it. My message to you as well, that help more people.
Thank you so much for giving your valuable time, sir. Thank you so much for guiding us as always.